The Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU has said it has begun investigations on the death of a 27-year-old Dr. Desiree Mora. Dr. Mora, who died by suicide on Sunday, September 22nd, had allegedly expressed frustrations at work, which friends believe took a devastating toll on her mental health. And as Helen Aura reports, Kiambu health officials have declined to speak in the matter even after a day-long meeting with stakeholders.
The death of Dr. Desiree Mora, a medical officer intern who was 6 weeks into her internship at the Gatundu Level 5 hospital, has shed light on the myriad of challenges that intern medical officers face in the line of duty.
Okay, when she was beginning this rotation, she was a little bit anxious. There's an aspect of strictness, okay, maybe too strict, and maybe the mode of teaching, it is more of a shame-based teaching. You are embarrassed for patients. You made feel like you know nothing.
By who?
Maybe some supervisors.
Mora was staying with a friend in an apartment that is a walking distance from Gatundu Level 5 hospital. Their apartment is on the ground floor. According to the caretaker who requested anonymity, Mora was more reserved than her roommate and mostly kept to herself. On Sunday, 22nd of September, the caretaker found Mora's lifeless body dangling from the 4th floor past 9 p.m. and alerted the police.
And officers from this station went to the scene, which is around 600 meters from the station, in an apartment within Gatundu town. And we established that there was a lady, aged 27 years, about 27 years, who had committed suicide.
The body has been taken to Gatundu Level 5 hospital mortuary, where the autopsy has been conducted. According to the autopsy report, the cause of death is asphyxia secondary to the neck compression due to strangulation.
Some of the things that are coming out clearly is what we have always been talking about: shortages of doctors in the hospital. The hospital does not have adequate number of medical officers. Even the pharmacists are not adequate, even the dentists. And it's not just a shortage, but acute shortage.
According to KMPDU, Gatundu Level 5 hospital had 10 medical officer interns, but the number has dropped to 8. One of the interns requested for a transfer to a different facility over allegations of frustrations.
Yes, it is true. We have heard the allegation, and it may not be very different from what has been happening before. You know, we are changing. The country is changing, and everybody would want to. The generations we are raising is not the same as generations that were there before. Harassment during ward rounds has been a thing that has been there persistently, and we are not encouraging it. If anything, we are hoping, and we are going to talk to our members to make sure that they make the interns as comfortable as possible, but still make them learn as much as they're expected to learn. Early enough, even in school, cane used to be used, but we have moved away from the cane. We are using other methods, so we're also encouraging our senior doctors to use better methods to communicate to the interns in acceptable language.
The Kiambu County administration has declined to comment on the matter. Kiambu County officer also turned down a request by reporters who have been camping at Gatundu Level 5 hospital since morning. After the end of a 56-day strike, KMPDU signed a return to work formula with the national government and agreed to resolve medical interns' pay dispute within 60 days. A dispute that has since taken a different trajectory, as both parties now await a court ruling on the 26th of September to determine how much medical, dental and pharmaceutical interns will be paid. This is where Dr. Desiree Mora started her internship mid-August, elated to establish herself in the medical field, but due to the alleged frustrations behind this walls, she was pushed out of her dream. And now, for those left behind, they have to find refuge to safeguard their dreams. Helen Aura, NTV.